Hi, I'm Melissa Moodley. I'm head of healthcare at Ipsos UK, and we are starting a new podcast called The Big Picture. And I'm delighted in our first episode to be welcomed by Dr. Stuart Flint, who's associate professor at University of Leeds. He has a special interest in attitude and behavior change, and especially with regard to psychosocial aspects of obesity. So what are some of the recent developments in obesity management that really excites you the most right now?
Well, inevitably, there's a major focus right now on the new medications. I say new, they've been around for a few years now, but the new medications for obesity, and they are showing some significant benefits across health. Of course, the primary focus has been the benefits to weight management, and some of them are showing, for instance, 15 to 20% weight loss in some of the clinical trials. But the really great news, and I think it's one that we need to be paying more attention to, is the potential benefit that these medications can have beyond weight. So, for instance, some of the clinical trials have shown that they could be beneficial in improving sleep apnea amongst some patients. It's been shown to be useful for patients with chronic kidney failure. It can reduce the risk of major cardiac events. So there are some wide-ranging benefits which I think will continue to unfold, and it's one that we really want to keep our finger on the pulse. So I would certainly say that that's creating a major buzz globally in terms of their potential impact in this space. Inevitably, I think some of the new interventions, so digital interventions, for instance, is also an area that is proving to be quite interesting and potentially exciting. That might increase, for instance, people's access to different types of treatment, and inevitably, due to the current and maybe in some instances rising prevalence of overweight and obesity, and therefore potentially more people looking for support, the opportunity that digital interventions might offer, I think, should also be something we pay attention to.
Absolutely. And we're definitely going to talk more about the treatments and what's been happening there. And I think talking about the digital kind of support as well is a really interesting topic. Of course, many of the drugs are not new, and there is quite a lot going on at the moment. Why do you think it's a really critical moment for action right now?
I think there's several reasons. I mean, inevitably, for many years, we feel like it's quite recent, but actually for many years, obesity has been increasing in terms of the public health focus, the policy focus, and probably in some instances, the accumulation of evidence that suggested that many of the interventions that have been tried and tested in the past, and maybe what policies have focused on, haven't been as effective as maybe they have intended to be. So, for instance, we know from some of the research that was conducted at the University of Cambridge, where they were reviewing the policies that have been put forward in the UK. So they had a study where they looked at policies over a 30-year period, 28 years, so nearly 30 years. And they showed that there was well over 600 different policies that were put forward and 14 obesity strategies that were implemented within a 28-year period. That's quite unprecedented, so many different policies. The consistency between them is that they're all placing the focus on individual agency and therefore a real focus on individual behavior change. And I think what we've really demonstrated over some considerable years now is that we need to have a more holistic approach, and that for many people, the factors that may contribute to their weight status and maybe efforts to change their weight status and health more generally may go beyond what's within an individual's control. And so, focusing solely on individual agency, I think is unlikely to lead to the benefits that we're ultimately looking for.
Yeah, so absolutely a critical moment. And I think a lot of your work has also been around stigma and around that, and how that can impact on people and their ability to lose that weight. And we'd love to come on to some of those topics as well around behavior and around the psychology of obesity too. So absolutely so much going on. Why don't we start with the treatment side of things and talk a little bit more about the GLP-1s? Of course, that's been in the news and in the public domain quite a lot. From your perspective, how is it reshaping the treatment landscape for obesity?
There's definitely a lot of focus, but I think across the different levels there's a lot of focus. So we see policy. There's a lot of activity within policy more generally about how we can potentially utilize the GLP-1s, the medications, within what we're doing in obesity services. Some of the long-standing issues that we've had more generally with obesity treatment is, for instance, issues around access, inequity of accessing treatments and so forth. And so I think what we have seen amongst policymakers is a real shift in, well, how do we address that? Because what we're actually seeing is with these medications that they could create a monumental shift in terms of the potential level of obesity within the country. And that's at policy level. Within healthcare, I think there's a lot of excitement in terms of their potential use. So within obesity, so complex obesity services, who may be supporting patients with obesity who have the most complex backgrounds, maybe living with several different health conditions beyond obesity, but also within weight management services themselves. And now we're starting to see, for instance, different pathways within the behavioral weight management services, which are usually local authority funded, which have a GLP-1 route now as well. So, I think there's a lot of excitement across many different levels, which may well be to the benefit based on the GLP-1s that have become a major focus in the country right now.
So it's almost like we're just starting to see what the impact of some of these GLP-1 drugs can have in obesity and beyond.
Yeah, for sure. And there's a lot of different trials that are currently ongoing in other spaces to really highlight the potential wide-ranging benefit that they may have. And it'd be interesting, I think, beyond some of the more physiological outcomes to see how it may benefit patients from maybe for some of the psychological and well-being related variables as well, which I think we'll see.
So there's definitely quite fierce competition when you look at the developments around GLP-1s. Almost every pharma company is, trying to get an asset in this space. From your perspective, how do you see how best big pharma can be navigating this competitive environment?
Yeah, and there's definitely a lot of competition between the big pharma, and we're seeing that now in the clinical evidence that's being published, but also, of course, the ongoing trials. So, many of the different companies are supporting trials that are really looking to demonstrate the benefit of those medications beyond weight status. And so we're receiving more and more clinical evidence that's being published through different journals and empirical outlets that demonstrate those benefits, and they are wide ranging.
And so who do you think could come out on top from a pharma perspective? Is it about what they're able to do across the different across the benefits and being able to demonstrate broad benefits? Is it about the evidence? Is it about the clinical trial design?
It's definitely about the evidence, and any evidence that suggests that one medication might be more advantageous than another in a specific area is clearly going to be important. I think we also need to understand, why would people ultimately use a GLP-1? And if we're talking about population groups who are using a GLP-1 beyond weight management itself, how likely is it that patients would potentially use that GLP-1? What's the potential market opportunity there? And maybe what's the other types of regulations that need to be considered, globally, potentially? If we take, for instance, a product that could be beneficial for diabetes, for instance, and most of these products that we're talking about are beneficial for both obesity and diabetes, the different variations. There are certain markets where the population is quite high. You take, for instance, India, which I didn't learn until last year, which was quite interesting. About 11% of their population is living with diabetes. It's 129 million people. So population and market opportunity there is high.
But still definitely lots of opportunity across the board.
For sure.
whilst there is significant opportunity, and for many people, these treatments have been life-changing, there are no doubt challenges. How do you see the challenges facing the GLP-1s?
Well, there's challenges to different actors in this space. There's challenges, of course, for patients, and they should be our primary focus, the most important individual within or actor within this relationship. There's challenges in terms of, for instance, access for some people. We have challenges in terms of the structure in which people can access these types of medications, but also more generally obesity treatments and services in the UK, which means that there are many people based on the region that they live in who don't necessarily have access to different levels of treatment. So we call them tiers in the UK. Some people don't have access to, for instance, surgery within their region they live. For some people, they don't have access to a tier 3, which is where you might be referred for pharmacotherapy, so the medications and so forth. So regionality could be one issue. For others, it could be access to the services itself, which could be related to location, cost. There might be many reasons which means that people can't access the treatments in the first place.
Absolutely, and you can see that being played out in all the markets where it's available. And of course, we spoke about this already. There's quite high public interest in the GLP-1s. I think it's not often you see a treatment being talked about, so openly in newspapers, in fashion magazines. It's everywhere. What's your view on this and the impact that this particular aspect is having?
I mean, there's definitely positives and there's negatives, in my opinion. But the positives are, inevitably, it's great to be able to get information out about evidence-based medications or treatments to the population. And I think also for some people, it's an opportunity to present information that has, some good news, I think, as well. Because I think for a long time, obesity has been rising. The prevalence of obesity has been rising. In some instances, there is, certainly amongst some groups at least, a perception that obesity is insurmountable because, there's been different types of policies and interventions globally to try and reduce the prevalence, or at least the rates of which obesity has been increasing for many decades now. The reality is that obesity has continued to increase, and overweight, people who are falling into the overweight category, has also increased. So, certainly for some, there will be some good news in that there are evidence-based treatments that are proving to be effective, at least within clinical trials. And now we need to see whether that translates into a difference that could be made on a population-based level. So, I think there are some good news and benefits to that. The drawbacks or the potential negative piece here, I think, is that there hasn't been enough regulation in how the information about the medications have been translated to the public. It's something that we all could see. We needed to manage this message going out. Right now, for instance, there are discussions and even encouragement of people using the GLP-1s, the medications, who don't actually meet the eligibility criteria for accessing these. Now, these are products that have been clinically tested, clinically proven, and deemed to be safe. There are always some risks to all medications amongst people who are either living with obesity or the variation in the medications for people living with diabetes. Unfortunately, we have people who do not have either. There are many people, for instance, who are accessing the GLP-1s who would fall into the healthy weight range, for instance. And we know that right now, via online subscriptions and elsewhere, people are able to access these products. And again, they've not been clinically proven to be safe or effective. Ultimately, if we're thinking about the GLP-1s in relation to obesity, they've been designed for large quantities of weight loss, 15 to 20%. And if somebody who falls into the healthy weight range was to access these products, that's a lot of weight for anybody to lose, which could be quite dangerous. And, are they really informed about the side effects? Because there are, many side effects, like there is for all medications. There are many side effects that we know are associated with the medications, which go from potentially increasing the risk of different types of body image concern and disordered eating behavior. But we know that the side effects of using the medications themselves are gastrointestinal, including nausea and so forth. So, people need to be well informed if they're going to be using any type of medication. And I think what we really want is that that these medications are accessed by population groups who the clinical trials have proven to be safe and effective for.
Yeah, absolutely. And aside from all the, positives it's brought, as you said, the regulations are so important. The tightening up, which probably needs to happen quite quickly, because not only is it a safety issue, it's also affecting the access for the populations who really need it and can benefit from it as well. So the GLP-1s have become quite an interesting space in the healthcare market, and quite different probably as well, because precisely what we've just said, how it's really come into the public domain. But this is not something which pharma companies are used to. And almost, a bit of a different question is, it's really becoming more in the consumer domain. And what, if anything, do you think pharma companies could learn from the consumer companies or the consumer marketing side of things?
It's a challenging question. And linking to probably the previous question, one of the things that I would probably say is right now, because these medications shouldn't really be in a consumer-based space, they really shouldn't be learning too much as such. So, if they are proven, if we have the clinical trials, they're proven to be safe and so forth, then, I'm certainly not in a camp that says that people shouldn't be using them. My perception is that right now the current medications, are not going to be applicable for the general population, but maybe as iterations move forward, new variations potentially that make it something that could be relevant for somebody maybe in the overweight range, for instance, or specifically for people with different health conditions without obesity, then that's when I think there's a potential to take on a more of a consumer-based approach. What can they potentially learn? Well, it depends what their focus is. Now, inevitably, there's going to be a focus on how to reach more people. There's a business element to anything like this. In many instances, a lot of their work has already been done, because you have different actors like Elon Musk, for instance, and others who are quite high profile, who are already doing so with some medications, one of the challenges is, well, the two challenges for most medications is uptake and then adherence. I would say a lot of the challenges around uptake are probably not there because, of the different actors who are involved here. And so that's why we're seeing such a high demand already, and a high demand amongst people in the general population.
A lot of care and caution to be practiced, and maybe not learning too much from consumer businesses. So you quite clearly say there's a need and a space for both. It's not one or the other. But do you think there will ever be a point where obesity drugs become as ubiquitous as vaccines, for example?
In their current form, no. But my expectation, whether it's right or wrong, in terms of whether it should happen, is that over time there will be variations to the medications that make it something that maybe is more appropriate for use outside of the two clinical groups that I mentioned before, that's been proven to be effective and safe for, which is people with diabetes and obesity. I think where those variations come in, then potentially it becomes something that maybe make it more likely to be used in line with, for instance, vaccines and so forth. But they would need to have a different target. Clearly for the general population, 15 to 20% weight loss is not appropriate for a lot of people. And we need to make sure that we don't use medications or any other form of treatments where there are potentially some quite negative outcomes that could occur.
So not right now, but maybe in the future, and depending on what that looks like. And of course, there is a need to keep developing and innovating in the field. But at the same time, there also need, you talked about access quite a lot, through our discussion. We also need to ensure there's affordability. So what do you think governments could do to incentivize this innovation and development, but at the same time trying to tackle the affordability?
Well, I think there's several levers that will come in. Now, there are, of course, there's currently 2 medications that have been developed and are currently available within the UK and also in the US, but other markets. There are other products that will come over time, and with more options, that may well have an impact in terms of pricing. What can policy makers do? And in sense of the question is where do you want to prioritize obesity? I think because there is some innovative thinking that can be done amongst governments to be able to reduce pricing if obesity was prioritized. And maybe obesity should be prioritized because it's not just obesity is different. Obesity is not a sole end health outcome. Obesity also potentially increases the risk of many other health conditions, from cancer to different types of cardiovascular disease and so forth. So maybe for the increased risk that obesity also potentially poses for other health conditions, maybe it should be increased in terms of its prioritization, and therefore that might mean taking steps to reduce the cost of accessing the treatments.
Which also links back to your point about everything around obesity should be much more holistic as well, not looking at it as a condition on its own, but by reducing the impact, what impact that can have on many, many other conditions and the general health of individuals and the population.
Yes, exactly. And, you've actually nudged me there, because I think what's critically important, again, which is missing from a lot of the conversation and the messages around the GLP-1s, is that yes, there is the medication, but ultimately there is still a need for behavioral changes alongside the use of the medications. And for many people, that will require a support mechanism. So access to different types of healthcare professionals, whether it's a nutritionist, a dietitian, access to psychologists. And the reality is that for many patients living with obesity, we're talking about people accessing clinical care. Psychologists are typically one of the most common requests to be able to speak to a psychologist about mental health. One, mental health that people are currently experiencing, but also the potential impact that accessing a medication, the different changes that ultimately occur when you're on a form of treatment. There is a need to be able to access that professional support. That's missing right now. And so for many people, they're receiving this message that you can access a GLP-1, you can potentially lose weight. It's relatively easy. And the reality is that it's far from easy. That kind of message that it's an easy way out, which has often been ascribed to bariatric surgery in the past. I think we're seeing that with GLP-1s, but that also comes from, I think, the encouragement of using GLP-1s from the likes of different influencers and celebrities who are not living with obesity. So I think it's important to note that there are many behavioral changes that are required alongside the medications. This is really not a simple form of treatment.
Which probably takes us to another topic around personalization. And we hear a lot about personalized approaches, not just in obesity, but in healthcare more broadly. And this is something I know that you've written about in the past. Can you tell us why this personalized approach is especially important in the field of obesity?
Yeah, and let me first tackle the first point you made. Personalization is certainly being talked about across healthcare. It's actually being celebrated in many instances. We need to do more personalization. Personalization is going to be better for patients, but also for healthcare units and what we're doing more generally in that setting. Actually, within obesity, it's not quite the same. And my opinion on that is because of this perception again that actually with obesity, it's just about individuals eating less and moving more, and we don't need to personalize. When we don't have the same understanding, compassion, or empathy towards obesity that we have in other areas, such as, for instance, cancer or so forth. So I think that is an issue. Why is personalization incredibly important? Well, the one-size-fits-all approach clearly is something that doesn't work. As I mentioned, it is appreciated in other areas. And if we ultimately want to be able to engage individuals, then we need to start to tailor at least. So there are benefits to precision-based medicine, but then also to personalize. And personalization can take many different facets as such. How can we personalize the way that we approach the general population, for instance, if we're talking about prevention, to support them to engage in different types of healthy behaviors, to better understand, for instance, the benefits of physical activity, of healthy diets, of getting good quality sleep. And there's many different types of health-related behaviors that we can start to personalize, and that's personalized communication. Then when we start to talk about treatment, well, I mentioned before, there's no one pathway or combination of factors that impacts everybody's weight. It's all very different. So we need to be able to understand, well, what are the factors that impact your weight? What is the factors that impact my weight? And how can we then start to tailor and maybe even personalize the approaches for you versus me and for other people? That's why it's needed. If we have the same approach for everybody, knowing that the evidence tells us that weight is impacted differently, factors are different between us, and what's likely to motivate me versus you and other people, then we're not going to be effective if we just use a one-size-fits-all. We need to personalize, and that will inevitably have a benefit in the long run.
So we do need to personalize, but there's a lot of catching up to do in the space of obesity, and really wanting to see those shifts from the individual to the more holistic and more personalized approaches as well.
Yeah, and one thing I would say is that we're certainly taking some really good steps in personalizing based on people's physiological markers, genetic background, and so forth. But we also need to do more. We need to do a lot more in how do we actually work with people, work with patients. And that means how do we understand what's happening up here? Because the reality is that, no behavior happens without a cognition, whether that's conscious or subconscious. So we need to understand, well, how do we potentially support and impact the cognitions that lead to behavior change? You can't just focus on the behaviors. We need to think about attitudinal cognitive factors as well.
Absolutely. So in the same way where the approach from a policy perspective or different stakeholders needs to be holistic, you have to look at the individual holistically as well. So the psychology and the physiological.
Exactly. Yeah. And that's why patient and public involvement is so important in the research that we do, but also needs to be very important, very much a part of policy development and interventions that are delivered. We need to engage with the public. We need to engage with patient groups if we're going to understand, well, how and in what way could this be effective? I could create the best intervention in the world, but if it's not relevant to a patient group, or it's not acceptable to a patient group, it doesn't matter how good my intervention is. So we need to engage and understand, what are the nuggets of information that allow a patient or a patient group to engage with that intervention.
So making sure all of the key stakeholders are really involved in that as well. So no doubt through our discussion, we've seen there's been some quite significant milestones, some improvements, still quite a lot of challenges. But if we look ahead to 2030, what would be your one big breakthrough prediction that would really make a big change in the treatment of obesity?
I think there will be trials ongoing because I think by 2030, we won't have reached the market. I think there will be trials ongoing that look at variations in the medications that either one, widen the potential patient groups that could access and potentially use the GLP-1s. I think there will be variations under trials that maybe also look at lower doses, lower weight loss percentages or outcomes that again might mean that there is a benefit outside of obesity. By 2030, we should have at least 2 more medications in play based on where clinical trials are. I think there'll be more. And at the moment, the medications are delivered via injection. We should have oral options as well. And I think oral will make a big difference. At the end of the day, there's a lot of people who would much prefer to have an oral medication compared to injecting themselves. And then maybe the final thing would be having a medication that's less frequent to ultimately use. So I think they're probably the most obvious changes that I think will occur before 2030. Inevitably, I think we will learn a lot more over these next few years because, right now, where we started at in this conversation, there are so many trials that ultimately are looking at the benefits way beyond weight. So, we may start to, for instance, see benefits in the space of oncology.
Well, thank you, Stuart, for that fascinating conversation and for being our first guest on this podcast. And thank you, everyone, for listening as well. Do join us next time where we have another guest and dive in further into the topic of obesity.